my first experience was in the summer of 2023. I felt that you did your best, and everyone is very, very positive, very kind, very approachable. And the treatment from physio, as I mentioned before, was top-notch, better than anything I saw in London. I had more movement and less pain with the sciatica. And I'm focusing more on the diabetes.
Hello, will you please introduce yourself?
Okay, my name is Paul Merino, and I live in London, England.
Why are you here with us in Swiss Medica? What is your diagnosis?
I have type 2 diabetes, and I also have sciatica. And I've been struggling with them for 8 and 20 years, respectively. So I've been treating them with conventional medicine in the UK. And while it is controlled to some extent, I wanted to improve my situation. And that's why I've come to Belgrade to take part with the stem cell treatment.
How did you find out about the stem cells in general? Not about our clinic, about the stem cell treatments.
Well, it is a therapy that is discussed in the UK. For example, cancer patients in the UK can receive stem cell treatment. Unfortunately, it's reserved only for people with cancer. In the US, for example, in California, people have stem cell for other ailments too. And because of that, I've researched facilities in California, in Mexico, Pakistan, India, and also Swiss Medical, which you're a part of.
So what made you choose us?
Well, honestly, at first was geographically closer. And also, when I made some initial inquiries to Switzerland, your headquarters, I found that responses were always very quick, usually the same day. And I was able to dig I had questions, and then I would get answers, and I would question the answers, and I would get better answers. So in other words, the dialogue was open, and I felt comfortable to continue.
How did this communication, the preclinic communication, look like? It was only just the online communication. Did you have any consultations or any chat with the doctor before you came here?
The answer is yes. I started off with online communication, but then we went into a phone call. Then we went into a telephone conference call with a doctor from your organization in Switzerland, who went through my symptoms, reviewed medical files that I sent to her, and put together a treatment schedule, which seemed to make sense, and that's why I went forward with this.
All right, so we've discussed the preclinic. Now, what about your clinic experience?
So my first experience was in the summer of 2023, and I took my wife also at the time, and she and we both had ailments. You heard mine, but she had a frozen shoulder. And she had an operation which was supposed to help, and it really didn't. She still had a lot of pain in the shoulder, so she was hoping that the stem cells would make her shoulder feel somewhat better. And I sort of jumped to the conclusion here is after the treatment, she felt within, I guess, a week or two of returning to the UK, she had a lot more movement in the shoulder. Now, I think it was both the stem cells and also the physio treatments, which I think were excellent. And so she was very pleased. For myself, I felt a lot of relief from the sciatica. And I was able, again, I had more movement and less pain with the sciatica, and I'm focusing more on the diabetes.
So why are you here for the second time?
So mostly to work on my diabetes. So I would like to lower the blood sugar levels. It went down somewhat from the first visit, but I still need another big push downwards, which I'm working on, and also some follow-up physio on the sciatica. So I've had, so I was here for a checkup, but I decided to get a top-up, and I hope in another week or two I can send back the results of being positive, and plan a third visit so I can bring my wife to join me maybe in the summer.
So did I understand you right, that right now you're working with the doctors on a plan to work on your type 2 diabetes, right?
Correct. Yes.
That's
yes.
what you are concentrated.
Yes, that's I mean, because I think we seem to have the sciatica under control, and is it completely gone? No. However, it's much better than it was before.
Is there anything else you'd like to add about your stay here in Belgrade?
Yes, I think that what I found, and for me being in business for 40 years, if I had to sum up my experience with yourselves, and this includes your office in Switzerland here in Belgrade, is that you under-promise and over-deliver. And so that's important. I mean, so there was no rash guarantees that your diabetes will be cured, that your sciatica will be cured, but we'll do our best to help. And I came, and I felt that you did your best, and everyone is very, very positive, very kind, very approachable, and the treatment from physio, as I mentioned before, was, I think, top-notch, better than anything I saw in London. The doctors here seem to be involved in care and look at not only the medical condition, but the conditions surrounding the medical. What could be making it worse? What could be what we can do to alleviate the condition? So I think that I came with hope, but I was a little bit skeptical. But now I'm not a skeptic. I'm a believer. I think you help quite a lot. I think that your team is integrated. So everyone seems to know what the plan is for myself. When my wife was here for her, and I can see with the other patients too. There's a plan for everyone, and everyone gets the individual attention, which I really didn't expect. So that's why I think you underpromised and overdelivered.
Thank you so much. It's a really nice comment. What do you think about our medical staff? Are they well trained enough to do this kind of job? How do you find them? I mean, everybody, nurses and the doctors.
Yeah, I'll break down in three parts. Let's start with the doctors. I'm working with Dr. Lana now. Before it was Dr. Georges and some other of your physicians. And they, they know me before I arrive, but they understand the files. They've done their homework. They check their homework to make sure, or change things to make sure they understand completely what the situation is. And then they go ahead with the treatment, and they monitor the treatment from beginning to end. I know that when I finish up later today, I'm going to have a consultation with Dr. Lana, and she will tell me not only what happened medically, but her suggestions going forward, which I will take back to London and implement. For the nurses and the physiotherapists, I want to use the word sweet because they're sweet. They know you by name. They make sure that when you're going through the treatment, not only are you going through medical treatment, but you're feeling comfortable. You're not upset. You're not frightened by anything. They do everything they can to calm you down. The physiotherapists will tease me, at least, the men, and they will push you so you get the most out of the physiotherapy without getting hurt. And so again, when you leave from every session, wow, I have more movement. I can do more, which is tremendous. And then for the administration, like yourself, Anastasia, I think that that there's the the cultural part where you can come and see Belgrade. You can see Serbia, and you can see that perhaps what we hear in the West is not the same as the reality. I find Belgrade to be tremendously safe, easy, relatively easy as any big city is to get around, and full of history, which I love. So I like coming here, and I'm glad through this medical clinic I found a new part of the world which I could explore.
Thank you so much, Paul. Thank you so much for being with us, and we are looking forward to see you again.
Thank you so much, Anastasia.